Good morning. I've just come from the board meeting of the Betsi Cadwaladr University Health Board, and the executive report, one of the first items on the agenda this morning, was our feedback to the recommendations from the Older People's Commissioner report. The Older People Commissioner report was the product of visits to our hospitals and our community hospitals late last year, and we had 12 recommendations to respond to. We've been working very hard as a senior team particularly to show leadership in making sure that dignity in care is at the very heart of everything that we do in Betsi Cadwaladr University Health Board. Some key areas in here are areas like making sure that we've got good communication at the bedside with our patients. I've got Susie here as my demonstrator patient, but we need to make sure that this care is dignified for all adults, and in particular for those adults aged over 65 who've expressed concern with their hospital experiences. The Older People's Commissioner specifically asked us to look at leadership, and earlier today I've been filming for the Transforming Care project. This is our Betsi Cadwaladr project, looking at putting ward sisters and charge nurses right at the heart of care to make sure they are making the changes that they need to provide dignified care for their patients. In particular, we're bringing back the role of matron. We think that the matron role will be very important in terms of supporting ward sisters and charge nurses in delivering that dignified care and making sure ward sisters and charge nurses have every resource that they need to do that. In particular, we're looking at making sure we've got good systems for patient feedback. And earlier today the board heard about the PICUS inpatient survey that we did back in September, where 2,000 patients were questioned about their experiences. We had a really good response rate to that, where patients were rating their care in the health board as good or excellent, which is a fantastic achievement. But we know that we need to do more, and the Older People's Commissioner report is steering us towards some very specific areas. We know we need to do more on continence and care for patients. Things like call bell systems. We're quite old-fashioned with these, and there are new technologies that we can use that respond to voice as well as touch, or to movement if we've got patients that are at risk of falls. These are really important areas for older people. We're also looking at our work in terms of ward rounds and visiting times. We've noted that to promote communication and making sure that patients and their carers and families know what's going on, we need to make some adjustments to our ward routine, and that work has already begun under the leadership of Dr. Robertson and his team. So we've got some really good things to celebrate. I'd commend the report to you. I think all staff should read that and reflect on it and think about what they can personally do to make the difference to that older person that they're caring for. Thank you.